Skin cancer is a prevalent and potentially life-threatening disease that affects millions of people worldwide. Among the various types of skin cancer, basal cell carcinoma, BCC, and squamous cell carcinoma, SCC, are two of the most common forms. Let's explore these skin cancers in depth, discussing their characteristics, causes, risk factors, diagnosis, and treatment options. By the end of this video, you will have a comprehensive understanding of basal cell carcinoma and squamous cell carcinoma, helping you stay informed about these conditions and their management. Basal cell carcinoma is the most prevalent type of skin cancer. It typically develops in areas of the skin that have been exposed to the sun, such as the face, neck, and ears. BCC often presents as a raised, pearly bump or a pinkish patch of skin. It may have blood vessels that appear as fine lines on the surface. One notable characteristic of BCC is its slow growth and relatively low potential to spread to other parts of the body, making it less aggressive than some other types of skin cancer. Causes and risk factors for BCC. The primary cause of BCC is prolonged exposure to ultraviolet radiation from the sun or tanning beds. Fair-skinned people with a history of sunburn, and those living in sunny climates are at a higher risk of developing BCC. Additionally, genetics can play a role, as a family history of skin cancer can increase your susceptibility. BCC is usually diagnosed through a skin biopsy, where a small sample of the affected skin is examined under a microscope. Dermatologists are skilled in recognizing the clinical features of BCC and often perform biopsies when they suspect skin cancer. Treatment options for BCC. Treatment for basal cell carcinoma depends on the size, location, and subtype of the cancer. Common treatment options include surgical excision. The cancerous tissue is cut out, and the wound is stitched closed. Mohs surgery, a specialized technique that removes thin layers of cancerous tissue until no cancer cells remain. Curettage and electrodesiccation. The tumor is scraped away and then treated with an electric current to destroy any remaining cancer cells. Radiation therapy, used in cases where surgery may not be suitable, or when cancer is in an area where preserving surrounding tissue is critical. The prognosis for BCC is generally excellent, especially with early diagnosis and appropriate treatment. Squamous cell carcinoma is the second most common type of skin cancer. It often appears as a firm, red nodule or a flat, scaly lesion. SCC can develop on sun-exposed areas like the face, ears, neck, lips, and the back of the hands. Unlike BCC, SCC has a higher potential to spread to nearby tissues, making early detection and treatment essential. Causes and risk factors for SCC. Like BCC, prolonged exposure to UV radiation from the sun and tanning beds is a primary cause of SCC. Fair skin, a history of sunburns, and living in sunny regions are all risk factors. Additionally, factors such as a weakened immune system, exposure to carcinogens, such as arsenic or certain other chemicals, and a history of radiation therapy, can increase the risk of SCC. SCC is also diagnosed through a skin biopsy. Dermatologists carefully evaluate the characteristics of the lesion and may perform a biopsy to confirm the diagnosis and determine the extent of the cancer. Treatment options for SCC. The choice of treatment for squamous cell carcinoma depends on the tumor's size, location, and stage. Common treatment options include surgical excision. Similar to BCC, the cancerous tissue is surgically removed, and the wound is closed with stitches. Mohs surgery. This technique may be used for larger or aggressive SCCs. Radiation therapy, used when surgery is not feasible or in cases where cancer has spread. Topical medications. For superficial SCCs, creams or gels containing medication may be prescribed. Cryotherapy. The lesion is frozen using liquid nitrogen to destroy the cancer cells. Basal cell carcinoma and squamous cell carcinoma are two common types of skin cancer that often result from prolonged UV radiation exposure. While BCC tends to grow slowly and is less aggressive, SCC can spread more rapidly. Early diagnosis and appropriate treatment are crucial for both conditions. By understanding the characteristics, causes, risk factors, and treatment options for BCC and SCC, you can take proactive steps to protect your skin health, and dermatologists can provide timely and effective care if you are affected.